There are all these different levels of treatment, and I don't think people understand them. I don't think that providers, doctors, nurse practitioners, family practice, I don't think a lot of them understand it. And I don't think families or even individuals that are seeking treatment understand it. Hi, my name's Athena Huckabee. I am an advocate for people with substance use disorders. I wanted to talk a little bit about the substance use disorder continuum of care or system of care and how hard it is to navigate. Some of you might know David Sheff from the book he wrote, Beautiful Boy, and the movie that came out about that. David Sheff also wrote another book called Clean that's really great, that talks about the rehabilitation industry, around substance use and how difficult it is and how also not evidence-based a lot of it is. So I think people really need help understanding the difference between things like detox, which we're now calling medically managed withdrawal, outpatient support, which can look like medications for opioid use disorder, or can just look like seeing a therapist once a week, but could also look like something like intensive outpatient treatment or IOP, where people do programming, like 3 hours a week, 3 hours a day, 3 days a week. Or it could look like something more intensive like PHP, which stands for partial hospitalization, which is where somebody goes to treatment about 5 hours a day, 5 days a week, which is another form of outpatient treatment. Or it can look like, I think, what most people think of when they think of treatment, which is rehab, which is really usually a 30 to 90 day inpatient stay. But rehab isn't the answer to everything. It's not always necessary. And I think if people understood sort of those different levels of care and how they interacted, that would be really helpful. So if you need some help understanding those different levels of care, and especially if you're living here in New Mexico and you want to connect, please check out my information. My contact information is available on my website. I'd be happy to chat with you. And if you liked this content and would like to learn more, please feel free to like and follow, and we can continue the conversation. And I appreciate you being here. Thanks.